Hi, Gary Hubert at Fertility and Surgical Associates, and I wanted to address the question of whether or not it's worth doing egg freezing at age 35. And unfortunately, there isn't a very black and white answer for this. We find that the sweet spot or the ideal time to do egg freezing is generally between the ages of, let's say, 31 to 35. Under age 31, it may not be necessary depending on your personal situation. If you're being treated for cancer, if you're on medication which might compromise your ovarian reserve, these are reasons why you might want to consider doing egg freezing, prior. On the other hand, over age 35, you need a lot more eggs to be able to develop just a single or maybe a double normal embryo. So the goal here is not just to freeze eggs. The goal here is to be able to generate some normal embryos so that when you want to have a baby, you'll be able to do that. And we find that over the age of 35, you need considerably more eggs than you do when you're younger. So this is a decision that you can make with your doctor. It also depends on your medical history, your egg quality testing, and there are other factors that you may want to consider as well, such as when you may actually be needing to use the eggs in the future. So the answer is definitely not a no, but it's something that you may want to think about a little harder, because you do need quite a few more eggs to be able to have a normal embryo to transfer.